This is the third in our series of the demonstration of autonomic physiology and pharmacology, and today we're going to be talking about the adrenergic drugs, the sympathetic subdivision of the autonomic nervous system. What I want to do is I'm going to start out by, if I may, summarizing what it is that we have discussed heretofore, and that will lead us into the discussion that we're having today. We said that the most important biological function of the body was the maintenance of homeostasis, or that means the maintaining of a balanced internal environment. The internal environment is the extracellular fluid environment. Some of the components that we're talking about in the extracellular fluid environment are including our electrolyte balance, our acid-base balance, our temperature, and we said that the system that was responsible for doing that was the autonomic nervous system. We mentioned previously that when you really look at what happens with our body from a physiologic perspective, the body does two things and two things only, and everything can be related back to these two things. It contracts muscles and it secretes hormones, and these muscle contraction and hormone secretion are mediated by nerve impulses. And so that if we look at the functional unit, the smallest functional unit of the body being the cells make up the tissues make up the organs make up the systems, and the systems work together to maintain that homeostasis. We're talking about the nervous system. We said that there was a artificial, for the purposes of discussion, division in the nervous system of the central nervous system, which is the brain and the spinal cord, and the peripheral nervous system, which has two divisions, the autonomic nervous system and the somatic nervous system. The somatic nervous system is voluntary. It goes to skeletal muscle. It is the system that is monosynaptic. The system that we are discussing is the autonomic nervous system, your automatic nervous system, your involuntary nervous system. And that nervous system has two different divisions. It has the sympathetic subdivision and the parasympathetic subdivision. We talked about the parasympathetic subdivision and the cholinergic drugs yesterday, and today we're going to be talking about the adrenergic drugs and the sympathetic subdivision. The sympathetic subdivision is the thoracolumbar outflow tract, and that is to say from T1 to L3. And the parasympathetic subdivision of the autonomic nervous system is the craniosacral outflow tract. When we talk about the cranial nerves that the sympathetic fibers are hitching rides with, we're talking about 3, 7, 9, and 10. We said 10, the vagus nerve, if you appreciate from our schematic representations, was in fact the predominant cranial nerve that much of the parasympathetic subdivision of the autonomic nervous system was riding with in order to get to the effector organs. The other thing that we said was that the effector organs were three: cardiac muscle, smooth muscle, and glands. When we talk about smooth muscle, we are talking about vascular smooth muscle and non-vascular smooth muscle, which is our viscera. We said that the neurotransmitter of the parasympathetic subdivision of the autonomic nervous system was acetylcholine, and the receptor that acetylcholine was going to be interacting with on the effector organ was a muscarinic receptor. And today we're going to be talking about the sympathetic subdivision of the autonomic nervous system and the receptor, that norepinephrine, the neurotransmitter of the sympathetic subdivision of the autonomic nervous system, is going to be interacting with, is going to depend upon the effector organ that we're talking about. It's going to be an alpha-1 receptor, a beta-1 receptor, or a beta-2 receptor. The other thing that we said is that when we stimulate the sympathetic subdivision of the autonomic nervous system, we also stimulate the adrenal medulla. Specifically, the chromatin cells of the adrenal medulla are post-ganglionic sympathetic fibers that have arrested in their development, so they're going to behave in a similar way. They are going to release epinephrine and norepinephrine in a 4-to-1 ratio, so that the important thing for us to keep in mind and to remember is we talk about drugs, and we talk about these at physiologic levels, these agents as neurotransmitters. These are prototypes, so that the prototype, once you know the various physiologic and pharmacologic effects of the prototypes, then you, in discussing the other drugs in the classes, have a yardstick to measure your understanding and your prediction of the behavior, the pharmacological effects, as well as side effects, potential adverse effects, and toxicities of the other agents, so that the two prototypes that we'll be talking about today will be both epinephrine and norepinephrine. Okay. So again, on this first slide, you will appreciate that we have for you clickable items, reading with regards to your adrenergic drugs. It's going to Farm 2000. There's another very nice adrenergic autonomic nervous system tutorial that I indicate that is worth visiting here, and you have practice questions. I have set one here. Once you land and Farm 2000, there are other practice questions that you'll be able to access as well. Okay. Okay, so as an introduction, what we want to keep in mind is the distribution of adrenergic receptor subtypes and the number of receptors that are in various organs and the vasculature in the body, because that is what is going to determine the response that we're going to see to the administration of the adrenergic agents. So, for example, the adrenergic receptor type in the bronchiolar smooth muscle is principally beta-2 receptors, so that agents like epinephrine and isoproterenol will cause bronchodilation because of their activity at the beta-2 receptors. Isoproterenol, we'll discuss today, is the prototype beta-2 agonist. It is a prototype beta agonist. Actually, isoproterenol or isoprel is a non-selective beta agonist. And it is important for us to know when we talk about adrenergic drugs, whether we are talking about a drug that is going to be selective or non-selective. So that, again, isoproterenol is the prototype beta-2 agonist, and it is